Hello class, I'm Ivan Medrano, and the final mastery project topic I selected is the Health Insurance Portability and Accountability Act of 1996, better known as HIPAA. HIPAA was created to foster confidentiality systems within and without the healthcare facility to ensure the information about health will not be abused. Currently, any information that can identify an individual, such as name, address, and telephone number, will not be divulged unless a breach of confidentiality is needed. HIPAA protects the written, spoken, or electronic data. HIPAA also affects organizations which offer group or individual coverage to their employees. Insuring workers is a growing trend among businesses which want to attract and retain the employees or comply with the law. Of note is that the law protects workers from other HIPAA parties other than the employers. HIPAA recognizes the physicians, the insurance, the clearinghouses, and electronic service providers. Consequently, the policy ensures that these stakeholders adhere to the confidentiality rules. Broadly, HIPAA is known for safeguarding patient information. In the business setting, the law provides that workers who enjoy insurance coverage are not discriminated against because of pre-existing conditions. In addition, the HR manager cannot use patient information without their consent. HIPAA law ensures workers have access to quality healthcare, which has implications on HR, such as being responsible for informing workers of their rights, providing training, and adhering to record maintenance rules. HIPAA covers the healthcare needs of employees. Established in 1996, the Act has 5 titles. The first title guarantees the insurance coverage for workers and their families should they switch jobs or lose the employment. However, the employee cannot have a new health plan in this circumstance. The second title prevents healthcare abuse and fraud. Under this title, there is a national standard for identifiers for the medical insurance schemes, providers, and employers in automated healthcare transactions. Title III recommends the procedure for spending accounts of pre-tax medical. The title veils the variations in insurance law and deductions for medical insurance. Title IV encompasses the guidelines for group coverage and modification for healthcare coverage. Finally, Title V governs the corporation-owned life insurance policies. The title provides for the treatment of non-U.S. citizens and revokes the bank's rule to interest allocation policies. The 5 titles give individual and group coverage guidelines for business and healthcare providers. The 5 titles are useful in safeguarding patient or employee interests. HIPAA covers various health plans. The insurance plans for group and personal schemes undertake financial obligations of the schemes since they are the covered entities. Notably, the people eligible for health coverage include students, non-patients, health plans, billing companies, all people working in healthcare firms or in private offices, and electronic record companies. Accordingly, the health plan includes vision prescription drugs, Medicaid, health maintenance organizations, Medicare, long-term care dental, and Medicare supplements. The plan also incorporates the employer-sponsored healthcare plans and multi-employer coverage options. However, the employer should at least have 50 workers under this coverage. HIPAA's health coverage plans make healthcare accessible to people. The Act enforces the protection of employee medical records. The Act considers patient information as confidential unless exceptions stipulated by the requirement arise. In this case, the HR managers are compelled to protect the medical privacy of their workers. HIPAA also provides security measures like logging on and off devices and destruction of sensitive information. In effect, any unauthorized personnel will not know a worker's medical history, giving them security that their data is safe. Furthermore, any treatment and interaction between healthcare provider and their patient are kept secret. As such, HR will not be informed unless they are affected by the health condition and the patient gives consent. Similarly, HR will have to consult with the physician before accessing the worker's health details. The strict safeguarding of confidential information reduces the victimization of the patient within the business. However, HR may struggle to keep the information confidential. For example, when a CEO demands the health records of a worker, the HR manager might comply because his or her superior has made a demand. Even though the CEO will not act on the information, it still breaches the privacy rule and creates ethical and legal dilemmas. In addition, the HR personnel might be tempted to use confidential health details for their gain. Regardless of the situation, HR is expected to comply with this policy and protect worker information. In addition, the Act prohibits the denial of coverage due to pre-existing conditions. The HIPAA adds protection for group coverage that limits the exclusion for pre-existing health conditions. The employer thus cannot discriminate a worker based on his or her health status. In fact, the workers can enroll for new plans that give them special opportunities in various circumstances. Under this policy, the employee is guaranteed quality health care. Their existing conditions can be covered by the employer, which eases the worker's healthcare burden. On its part, the firm will have a healthy workforce committed to organizational goals. However, this rule is also problematic for the firm. The business would have to pay high premiums to cover special conditions of their patients. In effect, the profitability of the business is at stake because of the high expenses. The expense could increase as healthcare in the country becomes more expensive. In addition, any discrimination based on the worker's health could result in lawsuits and tarnish the firm's reputation. Under HIPAA, it is illegal for employers to discriminate against workers. HR also has to inform the workers of their rights under the law. HR has a responsibility of informing the workers of their privacy rights through notices. The notice should be given every 3 years for large and small plans. Being kept aware of any changes benefits the workers, and to make necessary adjustments on their part if need be. The transparency helps improve the health outcome of the laborers within their well-being is not affected. The organization will be held for being transparent and compliant with the law. Nonetheless, it is an extra task for the HR department. To begin with, HR has to be informed of any changes in HIPAA. The department would also need to consult legal experts to explain the implications of the changes to the staff and overall operations. The language must also be simplified so that the workers easily grasp the concepts. Failure to obey this rule will cause legal problems stemming from worker disputes. HR has to notify the employees of any changes to the law or face adverse legal outcomes. Equally, training is necessary for employees. The workers covered by the insurance should be taught what is expected of them. Notably, the lack of compliance could affect the worker and employer negatively. For example, if the employee commits insurance fraud, it will lead to legal cases that consume the firm's resources. As such, the laborers need to know their role in enforcing the HIPAA law. Other than the workers, HR members who are in contact with the confidential information should know the ethical and legal implications of their position so that they adhere to the rules. For example, the staff members should know about the hefty fines and possible prison sentences that result from breaching the HIPAA rules. All the employees benefit from understanding how their health plan workers and confidential information for HR. This means setting aside resources to facilitate the training. Bringing legal help and other experts will be costly. Furthermore, it takes the time that could have been used for production. Nonetheless, HR will have complied with the laws, enhancing legal safety for the entire firm and gain a positive reputation among the staff members. Training workers will be costly to HR, but it benefits the business and the workers. HIPAA promotes accountability and transparency. All the stakeholders in the insurance coverage are aware of their roles in promoting quality care for the workers. Moreover, HIPAA avails a clear audit to identify people who have access to information about the patient. The content is used to protect the interests of the patient. In the organizational setting, HR will be held responsible for using the records for purposes other than health. Colluding with physicians would jeopardize the standing of the healthcare personnel. Even the workers are supposed to keep their details safe. Accountability from all parties make it easy for HR to safeguard the worker details because no one would use the health records for personal gain. In addition, it raises ethics standards, making compliance easy. Accountability benefits all the stakeholders. HIPAA law ensures workers have access to quality health care, which has implications on the HR, such as being responsible for informing workers of their rights, providing training, and adhering to record maintenance rules. The Act considers patient information as confidential unless in special circumstances. In effect, HR managers are compelled to protect the medical privacy of their workers. The Act also prohibits discrimination on a health basis. The employer thus cannot refuse worker coverage because of their condition. It is almost impossible to avoid HIPAA as insurance coverage attracts workers or is subject to policies and agreement. The HR is tasked with taking corrective measures when HIPAA laws are breached. HIPAA promotes accountability and transparency. All the stakeholders in the insurance coverage are aware of the roles in promoting quality. HIPAA laws benefit the workers in HR when the rules are followed.